academician and researcher with nearly 3 decades of experience in clinical practice, assistant medical officer, lecturer, and is currently an associate professor actively contributing to the medical education and research with extensive involvement in community health camps, traditional manuscript documentation, and scientific publication. Dr. Subash Chandran has made significant contribution to Siddha medicine as a recipient of Government Tamil Nadu Environment Protection Award and the Best Doctor Award. Sir continues to advance Siddha medicine through evidence-based practice and academic excellence. We now request you to take over the session, sir.
Very much glad and pleasure and gratitude to stand before you on this special occasion. It's a national-wide program. We are as a part of Siddha fraternity. Today, the chairpersons, Dr. Shree Varma, is a very familiar person of Ayurveda. We are very glad to stand with you and Dr. Shivakumar and this session chairpersons. Dr. Chini is a very good administrator in our side, Directorate of Indian Medicine. And Dr. Shivakumar is my classmate and friend, Dr. Shiva Ayurvedic Pharmacy. Today, I present here regarding medical oncology in Siddha medicine. Oncology, today the emerging trends in the whole medical field. Every year, 30% of death due to neoplasm or cancers. So, we took forward our ancient traditional system of Siddha medicine to this field. More than 3,000, 4,000 years before, there are illustrations about the Putru-Noi, Vipurudi and other relevant terms is indicated neoplasms. Medical oncology in Siddha medicine is my title. What are deals with Siddha medicine regarding to indicate these neoplasm treatments? This is Siddha's new role in cancer medicine. Integrating ancient wisdom with modern metabolic science is quantum Siddha, stem cell nutrition and nanotherapeutics. These 4 categories in modern Siddha therapeutics in oncology. Integrating ancient wisdoms and ancient therapeutics with modern metabolic science. 5 pillars of Siddha cancer medicine, Siddha medical oncology. There is stem cell nutrition and regeneration and quantum Siddha principles and nanoscale Siddha drugs and synergy with modern compounds and pitta imbalance and metabolic alignments. These 5 pillars major role in treating neoplasms with help of Siddha medicines. Not only palliative care, there is a antimitotic principles, there is a lot of antioxidant principles is our drugs, 3 Doda Samaporukal. These drugs, in Siddha medicine, there is a lot of illustrations in traditional Siddha literatures, particularly Agasthyar Vaidya Valladi 600. 600 verses deals with particularly on neoplasms, that is called Putru-Noi, Vipurudi, Kanna Putru, Yoni Putru and Kudar Putru. These traditional terminologies indicates neoplasms. There is a lot of Valladi. Valladi means Cherangotai. That is marking nut in English, Semicarpus anacardium. This is a unique drug treating neoplasms in Siddha medicines. This Semicarpus anacardium we are using as much as like Rasasastra. In Gunabadam, we are using Padarasam, Panjasudam. There is equivalent with Semicarpus anacardium, Serangotype. This is numerous 600 illustrations, 600 medicines deals with Agasthyar Vaidya Valladi. There is a traditional text, stem cell nutrition and regeneration. Rasayana helps enhance MSC, proliferation and differentiation, micronutrient correction supports tissue regeneration in cancer-damaged organs. Herbs like Amla, Ashwagandha and Charangotai Semicarpus anacardium boost cellular repair pathways and antioxidant defenses. Zinc, selenium restore metabolic enzyme function and immune signaling. Ketogenic synergic mobilize endogenous stem cells via ketone body metabolism. Ketone bodies fuel mitochondrial reprogramming away from Warburg effect. And foods align cellular detoxification and healing. Integrative protocols enhance tumor microenvironment normalization. Understanding cancer, Siddha cancer classification, Putranoi, Vipurdi, Kanda Krandi, and Sembu Putru and Yoni Putru. There is Yoni Putru, uterine and gynecological cancers, and Sembu Putru, liver-related malignancies with the specific Siddha pathology, and Kanda Krandi, hard, fixed, non-movable cancerous tumors, and Vipurdi, cancers with the spreading or metastatic behavior, and Putranoi, general term denoting malignant growths or neoplasms and cancers. Our basic principle is three vital humors, Vada, Pitta, Kaba, in Tamil, Vali, Alalayam. In Thirukural, Miginum Kurainum, Noi Sedor, Nolar, Vali Mudal, Enniya Mundru. There is a basic principles of our Siddha medicine. Cancer is usually as a Mukutram disorders, Trigutra, Noi. Initial stage imbalance begins with Vadam, uncontrolled movement and cell division. Growth stage, Kabam increases formation of mass, tumor and space occupying lesions. Aggressive stage, Pittam increases inflammation and destruction of tissue. Then Siddha oncology follows multi-step process, purgation, internal medicine and external therapy, cleansing of body toxins before starting medicine. Internal medicine, herbo-mineral formulations. Majority, first we used herbs, then we use herbo-mineral preparation. Veru baru, thalai baru, minjinakkal, parpachendurangal paru. There is our ancient quote. Then external therapy, medicated oils, fumes and bandages for surface wounds. Diet, strictly regulated food to support healing. These are some medicinal plants. We are using key Siddha medicinal plants in cancer research. Totarcharingi, Mimosa pudica, immunomodulatory and apoptogenic effects. Then Manjal, there's a unique drug, Karkama Langa. There's a curcumin active against the gastrointestinal cancers and other type of cancers. Curcumin along with piperin from pepper, we are using as a adjuvant therapy for any cancers. There is Amucra, Withania somnifera, Withanidois, studies in breast and ovarian cancers. These are some references, Azadirachta indica, Nimbin, activity in liver and skin cancers. This Tulasi, eugenol medicated effects in lung and throat cancers. Official formulations, we are using official formulation Rasagandhi Melagu, we are called as RGM. More than 54 ingredients in this RGM. We are using a prime drug used to treat neoplasm, cancer, AIDS and other debilitating illness. We are using Rasagandhi Melagu, Nandi Melagu. There is semicarpus anacardium milk extract, that is Valladi, semicarpus ghee, Cherangote nei, and Amukra and Neeredi Muttu Valladi Melagu. These are 5 official preparations. These are semicarpus anacardium milk extract, hepatocellular carcinoma, aflatoxin B1. These are some experimental references. This is semicarpus anacardium. There is a marking nut. In our Ther and Karisal as a text, Serangote legium. Verulra Pinigalam, Sera, Vadi Valaganaka, Ser, Madia Pasiundam, Sangantra, Varamundam, Segandial Bol Tony Undam, Sedana Inbumalam, Seratune Menmelum, say in Muhambol Kalayundagum, Sil Kedanan Elilurume. Elilurume, whatever on the debilitating illness, how to rebuild our body. These are the references. This is RGM, human papillomavirus cancer, herbo-mineral formulation in Siddha system of medicine, is prescribed in the southern parts of India as a remedy for all kind of cancers, all kind of Putrunoigal. The extract free from the toxic heavy metals affected viability of both the cells. The chloroform extraction induced DNA damage and mitochondria mediated was indicated through the both cell response treatment. These are some evidence of RGM. This Nandi Melagu in mammalian carcinoma, efficacy of Nandi Melagu is tested in vivo study for its chemo, preventive and therapeutic efficacy. Nandi Melagu is not an equivalent of tamoxifen. It has good efficacy, non-toxic and safety up to the level of 900. These are RGM, which is used to treat prostate cancer, Rasagandhi Melagu, Siddha formulation with 38 botanicals and 8 inorganic in palm jaggery or egg base for cancer These are Siddha formulation recommended target disease and the literature evidence. This Turusu Kalimbu suggests for various cancers including gastrointestinal GIT tract cancers, Idi Valladi, Sudha Valladi Urundai, and Kandaga Valladi and Kaya Valladi. The Valladi types are from Serangotai, Semicarpus anacardium, Valladi Churnam, Thirunetra Churnam, and Amirda Kendi, Kukil Valladi, Maha Valladi Legum, and Chena Valladi. Vallari Kirdam and Putru Padangam, Rasagandi Maligu, Kukil Valladi Legum, and Vallari Kirdam. Documented anti-cancer mechanisms, activation programmed cell death pathways, immune modulation, antioxidant accidents, action, and anti-angiogenesis, and chemoprotective role. Mitigation of toxicity for conventional cancer therapies. This is our prime institution in the southernmost part of India. I am from Government Siddha Medical College, Palangotai. We are running a special OP for cancer. Our PG Department of Medicine run a cancer OP for free of cost. We are using Chengotai Nei and Perungaya Matrai and Valladi Nei and Rasagandi Meligu. We are dispensing medicine every 15 days without free of cost from Government of Tamil Nadu. The safety regulation, integrative use, metal detoxification, and quality of practice. There is a qualified persons and integrative oncology coordinated with care with oncologists if is essential. Clinical monitoring, regular liver, kidney, and tumor marker assessments, and complementary role. Siddha therapy does not replace surgery, chemo, radiation. Not only palliative care, we are trying to make as an antimitotic principle drug. And side effect management, reduce nausea, mouth ulcers, loss of appetite due to chemotherapy, and immune support, Kayakalpa, rejuvenation from Sirapukarpam. Herbs help to keep with white blood cells counts stable and RBC stable, pain relief through Varmam, external activation of vital points therapy, and herbal oils, yoga and meditation reduce fear of cancer. Study on molecular targeting gastric cell, focus on WNT oncogenic signaling pathway. We are study with MK University Department of Genetics, School of Biological Science with Professor Dr. Kumaresan. We are cell line work. Siddha medicines have proven clinical benefits, molecular and pathway specific action largely unidentified, need of target specific high throughput screening, gastric cancer driven oncogenic signaling pathways. To screen Siddha formulation for WNT signaling pathway inhibition, anti-proliferative effects in gastric cell carcinoma, and to identify target therapeutic potential, understand molecular action. And the Department of Atomic Energy and Madurai Kamaraj University Drug Discovery Initiative, gastric cell line based assays, AGS WNT pathway, major oncogenic signaling pathway, highly activated subset of gastric cell cancer patients, suitable target of precision and cancer therapy. These are the overview of oncogenic pathway specific modulator identification. We are running this work in Madurai Kamaraj University. These are signaling pathway 3, 4, 9 and 14, 11 and 14. Inhibition the growth, there's a red inhibition of growth. This is 8 out of 15 screened drugs of Valladi, previous listed, inhibited gastric cell growth, shown concentration dependent effects, several formation inhibitant, cancer cell proliferation demonstrated target anti-cancer potential. First identification of molecular level inhibitory effects of Siddha drugs, signaling pathway specific action in gastric cell carcinomas, validates Siddha formulation using modern genomics tools, demonstrates power of reporter-based assays. We are now using Siddha genomics, personalized medicine, not treat the disease, treat the individual only is our basic concept of Siddha medicine. Selective pathway focused therapeutics, potential role in precision oncology, conclusion, WNT reported Ashse is effective for drug screening. Siddha formulation show pathway-specific inhibition, enables molecular understanding of traditional drugs, support further clinical and translational research, and bridges Siddha medicine with modern cancer biology. Thank you. A short spell.
Thank you, sir, for your valuable insights and for enhancing our understanding on the subject. It is our privilege to welcome our chairperson for this session, Dr. Seeni, and we request her to enlighten us with her perspectives and knowledge.
Good afternoon to all. Dr. Subash Chandran sir, professor from Government Siddha Medical College, taken the topic for the medical oncology in Siddha medicine. Particularly 5 pillars of Siddha medicine, that is 5 medicines like Rasagandhi Meligu, Nandi Parpam and Legium, Nandi Meligu and Valladi Nei, and so many drugs he explained regarding the integrative research on cancer, particularly gastric carcinoma and remaining other carcinomas, and it's effective. Out of 15 screening samples, 8 got proved inhibition regarding the anti-cancer cells. And further, he explained about the government of Tamil Nadu supplying the free samples for special OPD conducting in Government Siddha Medical College, and integrating research regarding the cancer medicine in Siddha. It's a very effective, and it's now it's very much essential in Ayush streams for getting good health for all public. They can utilize these medicines and they can approach for further. Thank you, sir. Thank you, sir, for your valuable contribution in this Ayush Conclave and Expo. One more time, I appreciate your presentation.
Thank you, ma'am. To acknowledge the valuable contributions made during this session, I invite Dr. Shree Varma, Dr. Shivakumar to felicitate our speaker, Dr. Subash Chandran.
Yes, thank you, Dr. Subash Chandran. Your talk was wonderful. We are honored by your presence here. We at Wellness by Heartfulness, we are very well privileged to work with the Siddha system. We are the believers of Siddha system. That's the proud of this soil. We wish to work together. At this moment, I have to convey my gratitude to Dr. Sendal sir, NIS director. How wonderful, wonderful, good souls. Because of sir, lot of coordination made easy, and his guidance made us sit at this moment here. I wish Dr. Shivakumar to share his expert opinion on this presentation.
Thank you to Varma ji and respected dignitaries on the dais, off the dais, and budding doctors, future entrepreneurs and institution builders. Good afternoon to all. So Dr. Subash Chandran is having a rich experience of 30 years, not only in academic side, but also in research and industry side. So as per his presentation, the Siddha system is known for treating cancer in a larger way. Particularly the medicine called Rasagandhi Meligu, which was appreciated throughout the country, and many Ayurveda doctors are using this Rasagandhi Meligu for cancer management. Especially I want to say our the legend of Ayurveda, late Dr. Mahadevan of Darshanangopu. So he always used to praise Rasagandhi Meligu and Charangotai Nei. He used largely the practice of these 2 medicines in his practice, and he used to share in many dioceses, not only in Tamil Nadu but also in other states. So we appreciate Dr. Subash Chandran for his activity, for presenting this in various conferences. Thank you very much, Dr. Subash.
Thank you for your expert insights, sir. Now we shall proceed with the felicitation. I request Dr. Shree Varma to felicitate our speaker, Dr. Subash Chandran. Token of appreciation, and now again ask Dr. Shree Varma sir and Dr. Shivakumar to felicitate Dr. Shivakumar. In appreciation of the role in shaping this session, I request Dr. Shree Varma and Dr. Shivakumar sir to facilitate Dr. M.K. Sini. I again request Dr. Shree Varma to present a memento to Dr. Jayarooba ma'am. This marks the conclusion of our scientific session. The organizing committee expresses its heartfelt thanks to all the dignitaries present on the stage for their esteemed participation.